let's start talking about gait and analyzing them and get into doing some of this so you guys can see kind of my method for it. Like I said before, I don't want to ever slow someone's gait down. I want to see how they're walking at their normal speed. However, when we ambulate for a reason. We have a purpose, right? So just because someone can walk down a hallway that has to be quiet with no obstacles and they have to focus on the ground and what they're doing doesn't necessarily mean that they're a community ambulator to me. Okay, and sometimes I think we get so caught up in, well, it has to be measurable, it has to be this, it has to be this. But if we're not making them functional, then what good is it for them? If I have a patient who can't carry their coffee cup from the pot to the table because they're so off balance, they're not functional. If I have a patient who can't turn their heads when they're walking, then that's a problem, because if they're walking across the street and somebody honks at them and they try to turn but they lose their balance because they're not used to disassociating head movement from the trunk, that's a problem. And these are things that we as therapists have to consider and have to include when we're not only assessing our patients but when we're treating them as well. So, and there's been lots of studies looking at cognition. You start having somebody cognitively working while they're walking, it really affects them. If they get caught up doing something else, we've seen how many videos of people talking on the phone or texting and walking into things. So these are things, if we're trying to get our patients back to that top level, that we need to consider. Even simple things like, I might have a patient ambulate normally, and then I might give them a cold cup of water, and then I might give them a hot cup of coffee. And you're going to see differences in their gait, and you need to see how they can adapt, because that's huge. That's one of our big jobs, is to give patients the ability to adapt to their environment. Can they walk over uneven ground? Can they turn their heads when someone's calling at them? Can they change their direction when the dog gets up as they're walking through their house? These are things that they have to be able to do, and these are things that are going to make them safe and independent. So when you're assessing their gait, look at things like that. Have them turn their heads, have them carry something, have them walk faster, have them walk slower. I might even have them walk with their shoes on, and then I might have them take their shoes off. Because if they're getting up in the middle of the night and they're not putting shoes on, I need to make sure that they're safe. And some of this stuff may seem, oh, they can do that, but they can't. If you are a therapist in outpatient or acute care, go talk to someone in healthcare, in home health, I mean, because, and I've done it, I've gone in to see a patient in home health, I've read through the chart and what's going on, and I go to see them and I'm like, holy cow, they can't get out of bed by themselves. But the difference is that they had a hospital bed, they had the head raised up, they had rails, they had a nice small mattress they had to get up. And now they're at home, they're stuck in the king-size bed in the middle of it, and they can't get up. So no, they're not independent, because they weren't given the ability to adapt to their environment. And that's what we have to look at when we are treating our patients. Because you know what? For some patients, this is it. This is their life, and we have to give them 100%. And if we're not giving them 100%, then they need to find somebody who is.